Hey everyone, this is Illy, and today I'm excited to have Dr. Robert T. Muller, and he is the author of Trauma and the Struggle to Open Up, From Avoidance to Recovery and Growth. And I'm going to show you the cover so you know what it looks like. Hi, Dr. Muller. It's a pleasure to have you.
Nice to be here. Thanks so much.
Sure. And today we're going to be discussing kind of your work as well as your book. So could you share a bit about, what you currently do for work and how it connects with trauma?
Yeah, absolutely. So I'm a clinical psychologist, a professor at York University in Toronto, and I have a trauma practice and have been working in the area of trauma, writing, teaching, doing research with, on various trauma therapy treatment programs, and then doing psychotherapy as well with clients, myself actively over many years, 20 something years, 25 years maybe, something like that. So my work in the area of trauma and seeing how people, what prompted me to write the book was seeing how people, one thing that I hear so much is that people have a sense that they know that they've got this difficult story, this secret, this painful past, and very often people don't know even where to start. And so all they've done is just held it inside for many, many years. Sometimes they've talked with one person or another here and there, maybe, a girlfriend one time or a boyfriend, but, not really find a way to know what to do with this painful past. And so finding a way to help people slowly, gradually open up has been central to the work in trauma therapy. And so that's why I wrote the book, Trauma and the Struggle to Open Up, because I see how it is a struggle for people.
Yeah, it's a great title. So in that struggle, the struggle to open up and even know what to do, you say that there's ambivalence. You say that people have ambivalence about their past and about their trauma stories. What is the heart of that ambivalence for most of the clients that you see?
Yeah, okay. So what we see so often with trauma survivors is that many of them will avoid dealing with their painful past. And they avoid it because avoidance works. It actually is a successful, temporarily coping strategy. So when you drink or when you use sexual, whatever, you use sex as a way of not having to feel the pain, or you engage in substance abuse, or a number of different avoidance strategies, what you're doing is you're coping, you're avoiding the pain, and managing on a day-to-day level. The problem is, of course, that avoidance only lasts so long. It just doesn't, it's going to fall apart at some point. And it falls apart when people, have to meet different developmental milestones, or when they experience losses, a parent dies, or their child is incredibly sick, or the prospect of commitment in a relationship happens, or they're about to have the birth of their first child, or something like that. Different kind of developmental changes happen, and then people have a great deal of difficulty. And the avoidance strategies no longer work. And so this is often when the trauma from the past comes back. There's kind of a return of the past, and people don't know what to do with it. What's worked up until now is no longer working. And when that happens, then it's very overwhelming. And when people realize, and then sometimes people, I have clients who, like, they say things to me like, my boyfriend says to me that I really got a lot of stuff from my past I got to deal with, because it's kind of seeped out in conversations between the two of them. Or my girlfriend tells me I need therapy. And then I ask them, well, what do you think? And and they tell me, well, I had this thing that happened when I was a kid, and blah, blah, blah. And I don't know if it's a big deal. And I say to them, well, no, I don't know either. Let's explore. And then it becomes, it's a challenge for people, because they don't know where to start, and it's scary, and it's understandably scary. They've kind of kept it under wraps for
Yeah.
so long. And
Mm-hmm.
now opening up feels like, well, I don't even know how to do that. So
Yeah.
that's a big process early on in the work. So on one hand, people have this avoidance. On the other hand, because it works, on the other hand, there's a part of them unconsciously that's yearning to be
Mm-hmm.
able to share this burden. And
Mm-hmm.
that's the ambivalence. You know,
Mm-hmm.
on one hand, it works to sort of sweep everything under the rug. On the other hand, there's a part of me that knows deep down that
Mm-hmm.
there's a real pain from my past, and it's a burden, and I've been carrying it around, and it's heavy. And
Mm-hmm.
I need to somehow unload this burden, but I don't know how. And so there's where there's this ambivalence, kind of mixed feelings about their own past. So that's where the ambivalence fits in.